All right, if you're prepping for the NCLEX, you know there are some topics that are just guaranteed to be on there. Well, today we are tackling a huge one, the APGAR score. Getting this down isn't just about passing the test, it's about being ready for those first critical moments as a nurse. Let's get into it.
So let me ask you this. What do you think is the single most tested newborn assessment on the NCLEX? Yeah, if you're thinking APGAR score, you absolutely nailed it. You know, it seems like a simple little tool, but the stakes, they could not be higher.
And this right here from Simple Nursing, it really gets to the heart of the matter. The NCLEX, at its core, is a safety exam. It's testing whether you can keep your patients safe. So spotting a low APGAR score, that's about recognizing a newborn is in serious trouble and knowing you have to act like right now.
All right, so first things first, let's decode what APGAR actually stands for and get into how the whole scoring system works.
So the APGAR score is basically a super quick checkup on a newborn at 1 minute and then again at 5 minutes after they're born. And here's a big NCLEX tip for you. If that 5-minute score is below a 7, you're going to keep reassessing every 5 minutes. You need to see how that baby is responding to whatever help you're giving them.
So let's break down the acronym itself. The first A is for appearance. And really, this just means skin color. Are we seeing a healthy pink all over, or is there some blueness, what we call cyanosis?
Next up, P is for pulse. This is, just their heart rate. And this one is absolutely critical. It gives us a direct look at how stable their cardiovascular system is.
G stands for Grimace. And yeah, it sounds a little funny, but all it means is reflex irritability. Basically, how does the baby react when you stimulate them? Like say, if you suction their nose, do they cry? Do they pull away? Or nothing? Now for that second A, that one's for activity. This is all about muscle tone. Is the baby just kind of limp, or are they moving around, flexing their arms and legs?
And finally, we have R for respiration. For this one, a good, strong cry is exactly what you want to see. It's the best sign that they're making a healthy breathing effort.
Okay, so here's the master chart where it all comes together. Each of those 5 categories gets a score of 0, 1, or 2. Now, some key things to lock in your brain. For pulse, that magic number is 100 beats per minute. Above 100 gets you 2 points, below gets you 1. For appearance, a really common NCLEX trick, blue hands and feet, which is called acrocyanosis, that scores a 1, not a 0. That's pretty normal at first. And for respiration, a strong cry gets you those top marks. A perfect 10 is rare, but anything 7 or above is generally considered normal.
All right, you've got the basics down. Now it's time to put it into practice with a couple of NCLEX-style scenarios. Let's see what you've got.
Okay, here's our first case. Picture this. You've got a newborn. His body is pink, but his hands and feet are blue. Heart rate is 110. Respirations are a little rapid and irregular. He gives a weak cry when you stimulate him, and he kind of resists when you try to straighten out his legs.
So what's the score? Take a second, run through the list. You can pause here if you need to. What's that total number?
Let's walk through it. For appearance, he gets 1 point for the blue hands and feet, that acrocyanosis we talked about. Pulse is 110, so that's over 100, full 2 points. Grimace and activity are both a 1 for that weak response and some flexion. And finally, respiration. Even though it's irregular, the effort is there, so that's a solid 2 points. Add it all up, and we get a total of 7.
All right, scenario 2. This one's more serious. The infant looks pale and limp. Their heart rate is slow, and they're only showing some effort to breathe. Okay, take a moment again, pause and calculate it. What's the score here? This is a baby that needs your immediate, undivided attention.
Let's break down this really critical score. Appearance is pale, so that's a 0. A slow heart rate is under 100, so that's 1 point for pulse. The word limp tells you everything you need to know for the next 2. That's a 0 for activity and a 0 for grimace. And finally, some effort to breathe gets them 1 point for respiration. The total here is a dangerously low 2. This baby is in severe distress.
So, getting the number is step 1, but the NCLEX isn't just a math pest, right? It's all about critical thinking. So let's look beyond the numbers and talk about the nuances of the APGAR score.
Okay, this right here is probably the single most important safety point to remember. You never, ever wait for the 1-minute score to start resuscitation. If a baby comes out and isn't breathing, you act immediately. Resuscitation always comes first. It's also really important to know the score has its limits. Some of it, like muscle tone, can be a little subjective. Plus, things like a baby being premature or medications the mother received can totally affect the score. And most importantly, a low APGAR score is not a diagnosis of asphyxia. It's just one piece of a much bigger clinical puzzle. And if you're wondering why this is such a big deal, well, look at this. A study from 2022 found that almost 75% of nurses at one hospital had poor knowledge of the APGAR system. This isn't just some abstract topic for a test. It's a real-world knowledge gap where you, as a new nurse, can really make a difference.
So you have the score. Now what do you actually do? Well, in this final section, we're going to turn that number into a clear, concrete plan of action.
Here's your game plan, broken down by score. For a score of 7 to 10, that's normal. You'll provide routine care. Dry the infant, put them skin to skin. Easy. For a moderate score of 4 to 6, that baby needs some extra help. Maybe some stimulation or supplemental oxygen, and you're going to watch them like a hawk. But for a score of 0 to 3, that's an emergency. Your number one priority is immediate resuscitation. Things like positive pressure ventilation, and you need to call for help loud and clear.
We'll end with this question to think about. That APGAR score, it's not just a number you jot down in a chart. It's a fast, powerful way to communicate. When you score accurately and you act on that score appropriately, you are literally speaking for a patient who can't speak for themselves. So think about it. How does this simple score become a profound act of patient advocacy in those first critical minutes of life? That right there, that's the core of what we do.